State health officials are defending their decision to restrict indoor dining in Minnesota. Last week, Governor Tim Walz extended the pause at restaurants and bars through at least January 10th. Eating outdoors is allowed in open areas at half capacity.
Reporter Kate Raditz explains why health experts believe indoor dining is more dangerous than other activities.
Grocery stores and malls are especially busy around this time of year. We get questions from viewers asking, why can big box stores be open, but a local restaurant can't be for indoor dining?
The question all of us in the restaurant industry are asking.
Keys Cafe and Bakery owner Jean Hun says she understood the restaurant closures in the beginning of the pandemic when experts were still trying to understand the new virus, but says now it feels unfair. She thinks the contact tracing data would be skewed when restaurants keep names and numbers of guests coming in, whereas big box stores don't.
So when the only places that are where you're following people is restaurant industries, it makes perfect sense that that's what's going to show up.
We always look at, well, how is the disease spread?
Data released from the state showed that over 4,100 coronavirus cases have been linked to outbreaks at restaurants and bars since June.
I'm sitting with people often from a different household, and we're probably closer than 6 feet. So we're in close proximity, and we're there for a period longer than 15 minutes.
Assistant Commissioner Dan Huff says it typically takes about 15 minutes to inhale enough virus to become infected. At a store, you're moving, masked at all times, and typically not socializing with other households. He says even a busy checkout line at a department store would usually be less risky than dining inside with friends.
Whenever I talk or laugh, I expel more forcefully air, which means that virus is going to travel longer than and farther than if I was just breathing normal.
Kate Raditz, WCCO 4 News.
Assistant Commissioner Huff said that the state uses interviews to figure out where those infected with COVID-19 had close contacts.
About 1/3 of all cases have spread in the community from an unknown source.
It's a happy ending to what has been a long couple of months. We're going to tell you about one man who is now leaving the ICU after 42 days.